Yeah, this is Beatrice. I'm going to present on use of concept mapping to assess needs of the elderly persons. Globally today, I think there is an increase of older person population in the world, and this has caused a high public health concern, and it also affects the nursing profession. Due to the many health challenges the older persons face, this presentation will focus on the use of concept mapping to assess the needs of the elderly persons in order to see if they can be rendered holistic healthcare services for the improvement of different aspects of their lives. So that is the title, the use of concept mapping to assess the elderly persons. So the choice for older persons for the concept mapping comes as a result of the many challenges healthcare systems have had in determining the care that would be most beneficial to them. Aged people have a special perception about life and aging, and it is relevantly important for nurses to understand their views for better health. Their attitude towards living may have been affected with the aging process and choices they have made during the course of their lives, and this eventually affects their quality of life at a later stage. So the behaviors and the attitudes of the elderly people portray what choices they have made in their life. The choices they make in their life may be negative or positive, and these they come to manifest later in life, and they require that clinicians, nurses, doctors, everybody who is a part of the healthcare team, they should be able to assess the patients so that they can be able to enable them to access the better and meaningful healthcare services. Therefore, in this presentation, which was not entirely a grand research, it's a meaning exploration on how we can use the concept mapping, how it can be applied, how it can address the problems of the elderly people, because it is a means for evidence finding and also relating preferred choices into practice. So as we can understand as nurses, I think we have used the nursing care process for a long time, and which facilitates the identification of problems, setting of goals, identification of interventions and their rationales, and also to evaluate the care that we give to our patients. So concept maps, it's another model that can be applied, and they are essentially important in nursing as they identify actual and potential problems that can exist in the elderly people. They enable application of the nursing skills and knowledge, because as nurses are trained, they are able to interact with each other during concept mapping and able to bring out their knowledge and share information. The concept mapping session also improves better outcomes for people's health, and they help to develop the nursing base of knowledge. They enable for nurses to be able to better plan the actions for the good health of the elderly people so that they can have better health outcomes. It is a sure way of dignified care, and it uses a compassionate approach because the nurse becomes empathetic, understands the problem that the elderly person is going through, and they will be able to assist the elderly in achieving the goals for their better health. But we find that sometimes concept mapping can come with challenges. The patient has to accept. So a consent form must be taken to the patient to accept to have this concept mapping done on them. But also it involves the relatives, and the patient has to identify which relatives they are comfortable with in doing the concept mapping. Are they acceptable to be a part of the team? And also the healthcare team, is it available to have that time to do the concept mapping? And also we should understand to say that it's a time-consuming process, but also it is costly, because sometimes you have to pay the people who will sit. It may take the whole day for you to understand the problems of that patient. So in defining, according to Aberdeen and Brian, defines concept maps as tools. They are a process to assess the existing and potential problems that can be experienced by any person. So the aim of this article, the presentation, is to validate that nurses can use the concept maps for person-centered care, which is individualized care, and also to realize information that is pertinent, important for nursing profession, that is for evidence-based practice purposes. So for this write-up, I engaged one elderly person who was aged 73 years old. She's a widow and she lives alone, and she's located away from the city center and the main hospital. She lives in an upstairs house, and all the bedrooms that she accesses are on the upper floor. She passes most of the time in her garden and she keeps a pet. But she came into the hospital complaining of insomnia, fatigue, painful legs, and unsteady gait. And she's in a state of panic because she wants to understand what is going on. So we want to see if we are going just to realize the same problems that she has presented to the hospital, or maybe by concept mapping, we'll be able to realize a little bit more problems. And we conducted the case conferencing through interviews and observation of the patient, which qualifies it to be a mini qualitative approach study. In this concept mapping process, the client participated in the planning and decision making for the choices of healthcare provision. So the patient is very important to be around, and all the members of the healthcare team who are involved in caring for this patient were present. So we have the nurse who spearheads the conversation. We have the doctor who is assigned to the patient, the nutritionist, the pharmacist, and the physiologist. This is important because all these have got different expertise in their areas and they'll be able to share, but also the patient will understand what is going on about their health. So during the actual mapping, the results that we found were that the strength that we found were that there was good verbal communication from the patient, and also hearing communication was enabled because the patient was using a hearing aid. The patient has got shelter, which means they're not destitute, and they've got somewhere they can call home. They have a strong spiritual support as they can go to church. They do gardening, which passes their time and keeps a pet, but also uses a mobility aid which prevents falls. So initial issues, which are the problems that the patient came with. She's a widow, she has pain, she has insomnia, fatigue, but after concept mapping, we found that we realized a lot more issues like depression, loneliness from being widowed and lack of family support, then lack of activeness because of the pain in the legs. She wouldn't be very active. Altered gait, altered nutrition intake, which leads to loss of weight and frailty. And the patient can have constipation because of lack of activities, difficulties to get medication because of the distance to the hospital, isolation, anxiety and restlessness, and impaired balance. Potential problems included grief, falls, delirium, and dementia because of the age of the patient. So the actual discussion, the process revealed that concept maps, they assist to identify and solve problems specific to an individual. They help a team of professionals to evaluate the care. They can be used on any person regardless of the age. They generate knowledge in a systematic way. They afford critical analysis and critical thinking processes in the nurses in problem solving. They are reliable for individualized care, which becomes holistic, and they generate evidence-based knowledge because the information that is shared among the healthcare team and the patient, I think it's of value to the nursing profession and the hospital at large and other professionals, whereby they can use the same information to generalize to people who have got the same characteristics. But when you realize the information, it informs the policy makers as well and the decision makers to understand what the elderly persons go through, and they'll be able to make policies tailor-made to suit the conditions of the patient. So in conclusion, you can say that concept maps are a philosophical view about how care could be improved, And the discussions that are done during that case conferencing, they are accounted for. There is better decision making and responsibility, because even the patient themselves, they understand where the problems are coming from, and they are able to say that they will cooperate, they will aim to achieve whatever was decided, because they were a part of it, they feel involved. And then it's applicable in any kind of situation that requires problem solving. It also helps the healthcare team to achieve optimal results through critical thinking and conceptual analysis. It accords a holistic approach for a comprehensive and reliable healthcare service. It also links for evidence-based practice, because through interaction with the patient, you can identify problems that can lead to other research. You can decide to research on a certain problem about elderly people. Like, for example, if we talk about dementia or delirium in the elderly person, what causes that? You can be able to identify future research that can come from the interaction that you have with the patient. I think having reached that, these are my references, and I say thank you.